I work with any patient, I'm sure I will fix it. I'm sure I will treat him. No doubt about that, whatever the case. And I am telling my patient, if I didn't fix you, no one will fix you. Okay? This is the confidence I get when I start working with ANF. I start learning. So the thing you learn here, you will not find it anywhere. I am Mohamed Abu Ali. I am a physiotherapist working in UAE, Dubai and Abu Dhabi. I am starting ANF therapy since 3 years almost. I see a big result with my patient, with my improvement with the patient, with the assessment, with the diagnosis, with how to do protocols for them, how to change my practice from getting like little result with the patient to complete their improvement and to satisfy the patient and satisfy myself with the result.
Could you give a little explanation what kind of knowledge and skills you said you got new knowledge from that you didn't even get in university or anything? What kind of new knowledge or skills?
Let's speak about how you are doing the evaluation for your patient as a physio or as a medical professional. When you have a patient, you need to do the diagnosis or the assessment for the patient. What we was doing before, just do some movement, okay, move your shoulder, move your elbow, like that. But now, with ANF, they teach us how to palpate, how to feel the tissue, how to find the root of the problem, how to feel the inflammation and the dysfunction of the patient, of the injury, direct in the joints or in the, where is it, to find it. And from there you start your treatment plan. Before we, okay, just move your shoulder, you have pain, okay, do this exercise, do this modalities, and we are not working on the root and treating the inflammation. We was working only to improve the range of motion or reduce the pain, but we was not treating the root of the issue. Now it's different. We are working on the root.
So you had to change your whole way of thinking.
Yeah, it changed my my thought about the injuries, about the human. How is the injury happening? How the inflammation? How to find out how is the problem it happened, from where it came. Okay.
How would you say that ANF therapy has transformed your practice, your clinic?
When I started ANF, I was working for a clinic, for a hospital. I was working in a hospital. Okay. After that, when I started studying ANF and started practicing, I moved to private clinic and I became part of this clinic and I own part of this clinic and I open another branches for this clinic because ANF give me more income, more patients, more access to more cases. I was working, for example, if the patient come for me for the knee, I will work only for the knee. But now when the patient come to me, I will find a lot of things. They have it and no one address this issue. So I will have access for treating many injuries, many problems, and I look to the patient from holistic point. The injury on the knee come from other place, for example, or they have chronic issue or chronic pain. So you need to look for everything, and that give you improve your practice, improve your income, improve your name, and the patient they need you.
Do you have any success story, an example you could give us?
I have a lot of success stories. With each patient I am working, I have success story. And now the thrust I have, okay, when I work with any patient, I'm sure I will fix it. I'm sure I will treat him. No doubt about that, whatever the case. And I am telling my patient, if I didn't fix you, no one will fix you. Okay? This is the confidence I get when I start working with ANF. I start learning. So I start feel when I'm getting any kind of injury, I can fix it. This is bigger success for me because I can work with any kind of injuries, any kind of problem. Okay, I have a lot of patients. They are, for example, have problem for years, and they've been with many doctors, many clinics, many countries, and no one treat them. I treat them. Okay, I see people, they are coming to my clinic and they are crying after I fix them because no one could do that. I have patients, they are suffering from problem for years and I fix them in few sessions. So
it's almost like the last stop.
Yeah, this is what I put in my social media. Your last destination. If you come to me and I didn't fix you, no one will fix you. How I heard about ANF? Okay, I heard from one of my friends. He was saying there is something, it's like disc, small device. You can use it and fix anything. So I thought this is unlogic. There is how it will do that. So after I see disc on him in his neck, and he explained to me. So I decided I will go to learn this. They reach here and I don't believe that it's working. So, but I want to find, because I have this. I want to know how it's working, if it is real or not. So a lot of people, they have the same. You have to try it. You have to come here, see how it's working, get the education, try it in yourself. Bring patient. In each level of ANF education, they are asking you to get test patient. Bring your patient, and this is what I did. In my case, I bring patient from Abu Dhabi here. Okay, come try, and I will see the result. And when I see the result, honestly, I was crying. It's something amazing. You don't need to think a lot and how it is working, why I will go for this, but you need to try it in your patient. Get the most difficult case, and come try with them.
Look, if we look at the future, how do you think ANF therapy could evolve?
See, I believe in few years ANF will be. I was saying this to Dr. Mikel. Okay, now, if you go to the car market and what is the trending now? It is Tesla,
yeah.
or the electric car. Okay, so this is in the car market. In the healthcare, within years, ANF will be the Tesla of medical or the healthcare market, for sure, within years. Join the journey before it will be, later on it will be not easy for anyone to start ANF, because now it's come learn, and it's not costing much comparing to other education. It is the cost, it's not that much, and you can get access for something. You can use it in the first day with your patient and change your game.
How long does the education take? If it starts on the 1st of January, how long would it take?
If you take it seriously, it will not take 2 months, 3 months. The AB1 till 6. Okay, still you need to go for 7 and 8. It is a practical, but for who don't take it seriously, it can take years. Okay, so see you soon, guys.